everyone, and welcome. Welcome to tonight's Ask the Expert webinar series hosted by the Melanoma Research Foundation. And this is as part of our Spot the Dog Pediatric Melanoma Awareness campaign. My name is Caroline Glavin, and I serve as the Education Program Manager for Rare Melanoma Subtypes here at the MRF. We're so glad you could join us tonight for this important conversation on pediatric melanoma, early detection, unique presentations, and prevention. We're honored to be joined tonight by Dr. Maria Buethe, a leader in pediatric dermatology, and Andrea Smith, a dedicated educator and mom who will share her family's personal experience with melanoma. I'll be introducing each of them in more detail before their presentations, but I know you'll find their perspectives both informative and inspiring. Finally, please stay with us until the end for a Q&A with Dr. Buethe and Andrea, and we will answer the questions the community has submitted. And I do believe we will also have time for some live Q&A as well. So feel free to send your questions in the Q&A section. And before we get started, I just wanted to share a little bit about the MRF. The Melanoma Research Foundation is the largest independent organization devoted to melanoma. Our mission is to eradicate melanoma by accelerating medical research while also educating and advocating for the melanoma community. The MRF is committed to the support of medical research to develop effective treatment and eventually a cure for melanoma. And we're also extremely excited to share a program that we just recently launched, SunAware. And SunAware is a sun safety e-learning interactive educational program, which was developed by the Melanoma Research Foundation. It is designed for children in grades K through 5 to promote healthy habits that help to prevent melanoma, skin health habits, skin cancer-related, and sun-related skin damage. To bring SunAware to your school or group, please scan the QR code, and I'll leave it here for a second, or you can go to our website and request a form. I'll give it a minute here. And just to mention as well, our tagline is empowering kids to be sun safe every day with SunAware. And these are just some photos of some of the interactive modules that we have available. All right, and as we mentioned earlier, September is Pediatric Melanoma Awareness Month. And although pediatric melanoma is rare, it is important to remember that early detection saves lives. As kids head back to school, it is the perfect time to build sun safety habits with the help of Spot the Dog, who you see here in the middle. As seen on the slide, right in the middle, as I mentioned, our guides how to use sunscreen like Spot the Dog and Spotting Melanoma Early offer a fun way to teach kids proper sunscreen use. And here at the MRF, as you see our educational literature listed, we know that education is critical for patients and families to make informed decisions about care. We are committed to providing free educational resources to patients, caregivers, family members, and providers, all of which are available to download or order for your school, health fair, conferences, or physician offices, and we ship nationwide. We also offer 6 animated patient videos with 2 more currently in production. These videos are less than 10 minutes long and pack a lot of information with great visual images. If you or your family or friends want to learn more about melanoma, these are great educational options to review. And this lists some of our modules that we have currently. We also offer patient and caregiver symposia series. Each year, the MRF hosts a series of in-person educational events in partnership with major academic medical centers. These meetings provide an opportunity to learn from leaders in melanoma and network with other patients and caregivers. We just completed 4 symposia, and you can go back and watch them at any time. You can find those links under the events tab on our website or on our YouTube channel. And we're excited to announce that we have 2 more we're hosting in the fall. So if you live near Santa Monica, California, or Houston, Texas, please keep an eye out for more information on those events. We also offer symposias, as we mentioned, and educational videos. So we're happy to announce that our YouTube channel has all of the videos that we've had, past events, symposia. We even have our Miles for Melanoma events recapped. Um, and we also have patient testimonials as well. So all of those educational offerings are on there. We also put our Ask the Expert events that you are attending tonight. That all gets uploaded onto our YouTube page. So if you ever miss anything, please know that it will be up on our YouTube page to review. We also offer a variety of patient and caregiver support services, such as the four you see here: patient and community forums, treatment center finders, financial assistant resources, and we also have a great resource called Ask a Nurse. She is an oncology certified nurse, and it's just a great resource to talk things through if you or your family are ever interested. And this is all on our website. The MRF is also proud to offer our clinical trials finder. The Melanoma Clinical Trials Finder is an invaluable tool that connects patients that with trials tailored to their specific diagnosis, ensuring they receive the most up-to-date care options available. And you can find this information on our website under the Patient Care tab. And what's really exciting and I think makes this offering so unique is you can request a navigator to talk you through the process. We have understood from countless times interacting with patients that clinical trials are really overwhelming. Although they're a great resource, we want to make sure that you have a partner in this. So that Navigator is a great resource if you're ever interested in connecting with the clinical trial finder. And there are many opportunities to support the work of the MRF through a variety of programs, events, and research funding opportunities. We host events such as a patient symposium, as I mentioned, our Miles for Melanoma 5Ks and walk in cities all across the country. And we hope you'll join us at one of those events. If you're interested, you can reach out to our education at melanoma.org to learn more ways to stay engaged with the melanoma community while investing in our shared mission of eradicating melanoma. And as I mentioned too, we have many ways that you can stay in touch, whether that be emailing us or staying in touch with our two newsletters that we offer. We have our Spotlight newsletter that is monthly, and we also have a quarterly Eye on OM for our ocular melanoma community. So if you're ever interested in staying in touch with our newsletters, you can scan the QR code here, or you can also go on our website and there's a link to add all your information in. Give a second there for the QR code. And then again, if you ever want to engage in our community or stay up to date with the research and awareness and campaigns we're offering, these are our socials. If there's anything, if you're engaging with SunAware and you want to share and tag us, please feel free to do so. These are some of our links for our social media. All right, and for more information, as we mentioned, please go to melanoma.org to learn more about what we are doing here at the MRF. Okay. All right, and I'm going to do a little bit of housekeeping before we jump in here. I want to remind everyone to take a moment to complete the survey that's going to pop up at the end of the Zoom session. Your feedback helps us to continue to grow these programs and ensure that they truly meet the needs of our community. Tonight's program will also be available on YouTube, as I mentioned, in just a few weeks, so you'll be able to revisit it or share it with others. And again, we encourage you to visit the melanoma.org to learn more about upcoming webinars, other educational or advocacy opportunities. And if you think of any questions later that you didn't bring up tonight, please reach out to us at education@melanoma.org. And on behalf of the Melanoma Research Foundation, I want to sincerely again thank Dr. Buethe and Andrea Smith for sharing their time and expertise. And we truly appreciate your attention here in this space and being committed to learning alongside of all of us. And I wanted to just take a second here and introduce our first speaker, who will be Dr. Maria Buethe. She is a double board certified dermatologist and pediatric dermatologist. She serves as the Division Chief of Dermatology at Rady Children's Hospital of Orange County and Director of Pediatric Dermatology at the University of California, Irvine. This evening, Dr. Buethe will be sharing important insights on how melanoma can present differently in children and teens, which warning signs to look out for, and practical steps families and clinicians can take to support early detection and prevention. And without further ado, I'm going to hand it over to Dr. Buethe here. I will go ahead and mute.
Hello, everyone. Good afternoon. Are you able to see my screen?
Yes.
Perfect. Okay, so let's begin. Well, good afternoon, and thank you to the Melanoma Research Foundation for inviting me, and thank you all for joining us this evening. So today we will talk about pediatric melanoma, its unique features, how to recognize it early, and then strategies for prevention. I have no conflict of interest related to this talk. So why pediatric melanoma matters? Well, while melanoma is generally uncommon in children, delays, what about that? Sorry, can you still see my slides? Can you see my slides?
Yes, we're all good. I can see you and your slides.
Perfect. Okay. So while melanoma is uncommon in children, delays in the recognition makes it like a very high stakes. And one of the issues is that pediatric melanoma often does not look like an adult melanoma. And the difference is really why education and awareness, thanks to events like this one today, are really important to really change prognosis. So, what do we know about how common is melanoma and how common is melanoma in children, really? So we know that cutaneous melanoma is the fifth most common cancers in adults in the US, but it accounts for about 400 to 500 new pediatric cases every year. Pediatric melanoma is about like 1 to 3% of all of the pediatric cancers. And as you can see here in the map on the right, this is the distribution around the US. So, what are the signs of an atypical mold, generally speaking? If we look at this picture here, we will see different features. We see, for example, that if we draw a line in the middle, the two sides of the mole, however you look at it, is not symmetrical. The borders are very jagged, and the color is not uniform. It has these like darker areas and lighter areas. And when we will go to measure it, we will see that it's often like more than like half a centimeter. And most often it has a history of a rapid evolution. So like changing rapidly in the past few months. However, when we go and look at pediatric melanomas, not just from our like experience as like providers that we are in the trench on a day-to-day basis, but also when we look at data from many patients that have been diagnosed with melanomas during childhood, we see that actually what you've just seen in the previous slide of that asymmetric atypical mold, that's not really applicable to our pediatric patients. This is a paper that was published a few years ago, and they reviewed all of the cases of melanomas. There were about like 60 confirmed melanoma cases, and they really went and looked at the characteristics. So what they found is that many of them are amelanotic. Amelanotic means that they're not like the classic brown macules that we see like general like moles. They are like bumped. They often have a history of bleeding. The color The color is not asymmetric as we saw before, but it's actually uniform. They are de novo. So in children, it's mostly like new moles that then are biopsied and they get a diagnosis of a typical mole or melanoma rather than on a pre-existing mole. So we have of these like ABCD criteria that we all use to guide us in the suspicious of when a mole looks atypical is not the classical ABCD, but when it comes to pediatric melanoma, we think about an forming color that is a new mole, and it doesn't matter what diameter it is or like how big the mole is. What it has in common with adult melanoma is this history of rapid evolution. When we think about pediatric melanoma, we characterize them in three different groups. We have melanomas that arise from congenital melanocytic nevi, so like moles from birth that later on they develop these like bleeding bumps on top of them. We think about Spitz melanoma, and the third category is the superficial spreading melanoma, which is very similar to the young adults melanoma. So it resembles like an adult type melanoma. I want to spend just a couple of minutes to really highlight and clarify the difference between Spitz melanoma and spitzoid melanoma, as you may have heard both of them interchangeably. The difference between the two is that a spitzoid melanoma is really like a regular, like it's a melanoma that may resemble, when we look it under the microscope, some features of the Spitz melanoma, but from the genetic and molecular standpoint is similar to just like an adult type melanoma. A true Spitz melanoma is something quite different. It doesn't just look unique under the microscope, but it has almost like a signature that is very typical to this type of tumors. And they have a better prognosis compared to the more the adult type melanoma. And that's why it's important to make that differential. So this is one of the example of melanoma arising from a congenital melanocytic nevi. So do all congenital melanocytic nevi carry the same risk? Not really. So we differentiate congenital melanocytic nevi in three main different categories: the small, the medium, the large, and then we have the giant. The ways that we know which categories the different type of congenital melanocytic nevi are is actually not the measurement that they have when we see a child in our clinic, but we measure projected adult size. So based on the location, then we calculate how big is this mole going to be. And depending on in which category it fits, if it's small, medium, large, or even giant, that gives us a different risk projection. So what we know is that for small or medium congenital melanocytic nevi, the risk is pretty small. However, here on the right, you will see a case of a medium congenital melanocytic nevi, which unfortunately developed a melanoma on top of it. So an early and careful monitoring is always advised. The risk then increase as bigger is the congenital mole, to about 2% for large, and then like 15% up to 15% for the giant. And that has an effect on like how do we change our monitoring, and how frequent would a child, for example, require physical examination. This is an example of a Spitz melanoma. The Spitz melanomas are really a diagnostic challenge because the vast majority of the time they come to us as pediatric dermatologists as a wart or a molluscum. Very frequently we have a pyogenic granuloma. Pyogenic granuloma is a um, benign vascular lesion that can look just like a Spitz melanoma or a Spitz tumor even. And that's also like a very similar history. So it's like rapid in growth, tends to bleed. So that does not, of course, help with the early detection, but it's something that we really want to like keep in the back of our mind, that any lesion that has like new, rapidly evolving bleeding bump, that should be excised and look it under the microscope to make sure that we are not dealing with a Spitz melanoma. This is another example of a patient that was initially diagnosed as molluscum, had several treatment, and then because of the non-response to the classic like molluscum treatment, was like finally excised, and it was deemed to be a Spitz melanoma. Here you will see other examples, and really like the more we see these like type of lesions, both clinically and also, as you see here, those are dermoscopy pictures, which are our like fancy magnifying lens that dermatologists carry with them, that allows us to look a little bit deeper into the lesion and really recognize the patterns of the vasculature and any other red flags that we may perceive when we take a really good closer look. I want to show you, this is actually an Instagram story from the Australasian Skin Cancer Foundation. And this is probably summarize what I also see the most. We have these like children, very young, with a lesion here that if you didn't know better, like you could think is a mosquito bite on another like molluscum, something completely harmless. But this later ends up being like a Spitz melanoma. And again, I cannot tell you how many times we unfortunately see this. So, what are the red flags that can help us with early detection? Again, any new growing bleeding lesion, like we emphasize these to pediatrician and parents all the time. If something looks good, looks new, is growing, bleeds without an explanation, so not just because of a trauma, please seek attention as soon as possible. And then even in children, there is this concept of the ugly duckling. So if you have a mole that is so different from all of the rest of the moles, that's when you really want to like have your like PCP take a look at, have them send a referral to a dermatologist so that we can look a little bit closer and we can have a discussion of if it's worth removing it to look it under the microscope. So how about management? Surgery is still the cornerstone for pediatric melanoma. Currently, there is no guidelines specific to pediatric melanoma. So we always refer to the guidelines for adults. However, this recent paper with evaluation and surgical management of pediatric cutaneous melanoma and atypical Spitz and non-Spitz melanocytic tumors, that really brought all of the evidence together, and it analyzes how these different lesions in children, especially the ways that they would respond to treatment, is really dictated from their genetic and molecular profiling, and how a genetic testing is important to also guide treatment and prognosis moving forward. So first, again, surgery is still the cornerstone. The sentinel lymph node biopsy is performed in select cases, and then systemic treatment like immunotherapy, that parents may hear about it as part of the melanoma overall treatment, that's being used more and more. However, we still need pediatric specific data. Um, and so what are the risk factors? Risk can be inherited, um, or environmental. For genetics, beside having a family history of melanoma, there are some particular genes that confer a much higher risk. And those include the CDKN2A, also called familial melanoma, or the MCR1, which is often found in people with a much lighter skin complexion. There are also some specific genetic diseases like the xeroderma pigmentosum that carries a very high risk of melanoma. So that, of course, will influence how we strategize together with the family in terms of surveillance. As we said before, large and giant congenital melanocytic nevi, they carry an increased risk. And so we really want to make sure to palpate and observe on a monthly basis and really be on the lookout for any changes. And then environmental factors. Childhood sunburns does increase the overall risk of melanoma throughout life, and tanning bed risk is up to 70 or higher percent, so that there are many task force that have been worked together with states to really ban the tanning bed because the association with melanoma is so high. How about prevention then? So we really want to again monitor for any rapidly growing bumpy spots in both new lesion and existing lesion. Increase surveillance in the presence of particular risk factors, like for example, familial melanoma, or specific genes, like in the case of the familial melanoma, which is when you inherit that CDK2A spot, if there is a history of immunosuppression or radiotherapy, or in the case of cancer predisposing condition, like for the genodermatosis that we talked before. And then the congenital melanocytic nevi, the large or giant, which will then change how we will perform physical examinations moving forward. Sun safety is still the most effective treatment, especially when starting early, because as we saw, sunburns during childhood also confer a very high risk of melanoma over time. And then educations to both families and school, and really to adolescents, and reinforcement of avoiding tanning bed. So in terms of prevention strategies, I will really recommend you to visit the MRF website because it does a wonderful pool of resources. This you see here is a parent guide to reduce the risk of melanoma. And again, it goes over different strategies in terms of sun safety, sunscreen, shades, hat, about the vitamin D that is not impaired by the use of the sunscreen. Again, just a very quick, friendly resource to see. And then for our little ones, I think that it's always a great idea to empower them to take pride and ownership of their like sun safety habit, so that they are the main actor in their life, and they can really be part of the prevention and make it as part of their routine. And those are, again, two examples of wonderful resources that are on the Melanoma Research Foundation website. In terms of future directions, so progress will come through collaboration and trials that include children, registries to follow them over time, and advocacy groups like the MRF. It's what keeps the momentum going. And in terms of take-home messages, pediatric melanoma is different. It can look different. We have modified guides, so we still use the ABCD, but it's modified for pediatric melanoma. We should all be familiar with how those look in our younger ones. And then prevention and awareness can really save lives. Thank you very much, and I will be happy to answer any questions.
Thank you so much, Dr. Booth. Go ahead and just wanted to say for the group, feel free to put your questions in the Q&A box and we'll come back to them after Andrea. But thank you so much for really such a beautiful presentation and great insights. Thank you so much for being with us. Now I'm delighted to introduce Andrea Smith, who has been an educator for 22 years and is currently a second grade teacher in Orem, Utah. I'm hoping I'm saying that right. In addition to her work as an educator, Andrea is also a proud wife and mom to Wilson, age 12, and Clara, age 9. Andrea and her family love all things Disney and enjoy traveling together. And tonight she'll be sharing her family's experience with pediatric melanoma and the vital perspective of a parent and caregiver. Andrea, I will hand it over to you.
All right. Thank you. You did say Orem correctly. Orem recently got put on the map because this is where Charlie Kirk was assassinated, just 2 miles away from us. So people are now knowing where Orem, Utah is, but that is where I'm located. Thank you for having me. I am certainly not an expert on anything except maybe teaching kids how to read at this point, but I am quite passionate about melanoma because it has very personally affected us. And my daughter, she was born in 2015. When she was about 18 months old. And as Dr. Booth was sharing, when she was showing those pictures, I was like, yep, that's exactly what it looked like on Clara. So when my daughter was about 18 months old, what I thought was a bug bite started forming on her calf, just a few inches below her knee, sort of on the inside of her leg. And we just assumed it was a bug bite or maybe a little pimple or something. It just started out really small and it just didn't ever go away. It kept getting bigger. And then all of a sudden I thought it was a wart. And as I took her to her pediatrician just for a regular checkup, I mentioned to the pediatrician, this thing on her leg is not going away and it's kind of annoying. And he said, oh, yeah, that's a wart. When she is 3 years old, when she can sit still a little bit better, because at this point, she's not even 2 years old. And when she can sit still a little bit better and understand to sit still, we'll just freeze it off here in the office. So I said, oh, okay, well, hopefully it's not still there when she's 3 years old, but okay. And he sort of sent us on our way. So months go by, it's getting bigger and bigger. And it got to the point where the best way I can describe it is it looked sort of like an eraser tip on the end of a typical pencil. It was about the same size. It was about the same color. It was definitely more scaly than an eraser tip, but it was about the same size. And that's about how far it came off of her skin. And it was just a super huge inconvenience because all of a sudden it started to bleed pretty regularly. So, we'd keep it covered with Band-Aids. I mean, it would just kind of ooze a little bit of blood, but nothing too bad. And one day we were driving in the car and she let out, and she was sitting in her car seat, and she was turned, rear facing still. And so I couldn't see her. And all of a sudden she let out this blood curdling scream like I had never heard before. So I mean, to the point where I pulled over and went to go look, and there was just blood just dripping down her leg from this thing on her leg. And I thought, oh my goodness, this is bad. I mean, so I'm trying to clean it up, trying to calm her down. We get on our way again. And I said, I just thought I've got to take care of this. This cannot keep happening. It is so bothersome. So, a few days later, I happened to be taking her shopping with me, and she was in her stroller, and I ran into a friend who, I hadn't seen in a long time, but I knew she was a nurse practitioner at a dermatologist's office. So I said, oh, hey, look at this thing on her leg. It's driving me crazy. And so I showed it to her, and she said, oh yeah, that's a pyogenic granuloma. Don't let the doctor freeze that off. It needs to be cauterized underneath because it's going to bleed like crazy when we remove it. So bring her down to the dermatologist's office. I said, is this something you can remove? She goes, I'd rather the dermatologist remove it instead of me. So just make an appointment. So I made an appointment. This was in August. So it kind of started in like April is when I first mentioned it to her pediatrician. So by August, I had gotten her an appointment just with a regular dermatologist, kind of feeling like I was going behind the pediatrician's back because he had already told me what it was and that it was a wart and there was nothing wrong with it. And he would take care of it when she was a little older. But I went down there, and the dermatologist said the same thing. He goes, oh yeah, this is definitely a pyogenic granuloma. We need to cauterize it underneath, but there's nothing to be worried about. So he actually, because I'm a teacher, my insurance starts over September 1st. And this was like mid-August, end of August. He said, and I said, well, can we wait until after September 1st so that because I was going to have to pay for it out of pocket, so that it will go toward my New Year's deductible rather than this current year. And he said, oh yeah, as long as you can handle the annoyance of it for a couple more weeks, bring her back in a couple of weeks. So I said, okay, thank you. And also I wasn't there at that appointment. My husband had taken her, and I was on a Zoom call or like on FaceTime because I was at work, and it was just during recess or something. I was able to join my husband and Claire at their appointment. And I wanted to be there when she had it taken off because I knew it was going to be a bit traumatic for her. So a couple weeks later, we took her back down and kind of had to hold her down. It was a little bit of a traumatic experience for all of us. And they were able to remove it, and they cauterized underneath and send us on our way. And it never even occurred to me that they were sending it in for a biopsy. No, that wasn't ever even spoken to me. And it was totally harmless. So no problem. So a couple weeks later, about 10 to 14 days later, I was in a meeting, and I got a phone call from the dermatologist's office, and I let it go to voicemail. And I checked the voicemail, and it was the dermatologist himself calling me and asking me to call him back. And I thought, that is so weird. Why is he calling me? So I excused myself from the meeting and went and called him back. And he said, I have never been more shocked in my entire life. I've never diagnosed this in a child, but we have found that your child has spitzoid melanoma. And he said, I don't know much about this. I've been doing a little bit of research. And the good news is, these were his exact words. They are like burned into my memory. He said, the good news is that if it hasn't spread to her lymph nodes, she has an 80% chance of survival. And all I heard him say was, there's a 20% best case scenario. There's a 20% chance your child could die from that thing we took off of her leg. And the shock, I didn't even understand what I was listening to. It was just so out of left field. I was so surprised and just taken back. He said, here in Utah, the cancer institute that's close by and well known is called the Huntsman Cancer Institute. He said, I've already reached out to the Huntsman Cancer Institute, and they'll be contacting you in the morning to set up an appointment. And I mean, my world just came crashing down around me. I thought, what on earth? What? So anyway, I excused myself from the meeting, called my husband as I was driving home, just in total shock of what I had just heard. And I was just panicked, of course. Over the course of the next few days, Huntsman called me and said, well, I've got good news and bad news. The bad news is your insurance isn't partnered with it. We're there, it's not in network. So you can't actually see us here at Huntsman, but one of our melanoma specialists works at the IHC facility, which is in network, and he can see you in that office, but you'll still be seeing a Huntsman doctor. So you need to call that number. So I call that number, and the lady at the office was like, oh yeah, our next appointment. And it was like 2 months away. And I just broke down into tears. And she said, I'm sorry, how old did you say this was for your daughter or your mother? And I said, this is for my daughter. She said, how old is your daughter? And I said, she is not even 2 years old. And the lady said, what time can you be here tomorrow? So they were very gracious and kind and got us right in. And we were able to go up the next day and meet with the melanoma surgeon. And he had this great plan for us. We were going to have the surgery, but then we got all tied up in all these problems because she was not quite 2 years old, and Huntsman, they were going to get special permission for her to have the surgery at Huntsman. And, but they have a policy that they don't operate on children under 2 because we have a children's hospital right next door, but the children's hospital didn't have any melanoma specialists. Anyway, so there was this huge confusion about how we could have her do the surgery. The melanoma specialist actually ended up getting operating privileges at the children's hospital so that he could do the surgery at the children's hospital. So that was a huge comfort for us, that she was going to be well taken care of at a children's hospital, but the melanoma doctor had to really go through great lengths, and he involved a pediatric plastic surgeon because he was unsure of how her skin was going to respond. They did a sentinel lymph node biopsy as well during the surgery, but they took out a huge chunk of her leg. She's 9 now, so this was 7 years ago. Actually 8 years ago. And she still has a big chunk of her calf taken out. But they did the sentinel lymph node biopsy, and we had to wait several weeks for that surgery to happen. In the meantime, they ordered a brain MRI and a PET scan. So she spent her second birthday. It's easy for me to kind of keep track. In fact, it all happened around this time of the year. Back in September and October, she spent her second birthday having her brain MRI, and the day after was the PET scan, or vice versa. So it's easy for me to kind of keep track of things because that's what she did for her second birthday. Anyway, after the surgery, we were so relieved to know that while they did find cancerous tissue in her leg that they had removed, they did get clear margins, and they also did not find any cancer spread to her lymph nodes. So we were very glad that she didn't end up having to do any of the treatment. It was just the surgery that she had to have. But then we also have to keep a really, really close eye on her. And she is currently now being seen by her melanoma specialist every year and a dermatologist every year for full skin checks, but they are alternating every 6 months. So we see each doctor every year. We've kind of graduated to that point. We see each doctor every year, but we see somebody every 6 months. Some things that we do to sort of kind of take care of it and keep a close eye on it. Now, when she was little and I, was bathing her and doing that, it was easy for me to keep an eye on all of her skin and check all of her little nooks and crannies and in between her toes. Well, now she'll be 10 years old in a couple of weeks, and it takes care of that herself. And it's a lot harder now for me to kind of keep a close eye, an eagle eye on her skin and any issues that pop up. But I still occasionally do sort of just, make sure, and she knows if there's anything that shows up on her skin, she has to tell me right away, and she does. So any little bump or mosquito bite or anything that she gets, she always comes and tells me, Mom, I've got something on my skin. So she's been trained really well. We also are really diligent about using sunscreen, and I have an older son too, both of them. She has a 504 at school. We put a 504 in place, and she actually has had an aide that is paid for 15 minutes a day to go and help her apply sunscreen, so that she's making sure that she gets sunscreen applied about 15 to 20 minutes before she goes out to recess. She also wears hats, and as long as she can handle the heat, we put her in long sleeves and pants so that there's less coverage that she needs of sunscreen. And I know clothes don't do a perfect job of blocking out the sun, but I feel like it does a better job than nothing at all. So we just are really, really diligent about sun safety and using sunscreen. My son, just the other day, he didn't know I was home. He had a friend over, and the friend wanted to go outside, and I had been gone, but I had come home and they didn't know I was home. And I overheard a conversation that just, I thought, okay, I'm doing my job as a parent of a child with melanoma. The friend was like, let's go outside. And my son said, well, no, let me check the UV index. And he has a way on his watch to check the UV index. And he's like, hey, what's the UV index? He said, oh, I can't go out. The UV index is 3. I can't go out unless it's 2. And the boy said, it's cold outside. You're fine. You're not going to get sunburned. And my son went into this whole long explanation of how the UV index doesn't matter. It doesn't care how cold or warm it is, because it was kind of an overcast. He was like, it's a cloudy day. He said, UV rays can still get through clouds. Anyway, he's educating this friend on why he can't go outside until a little bit later, until the UV index goes down a little bit. And I thought, okay, he fights me, but he's been listening and he's learning and he knows that this is important. So I had my proud mom moment there when I heard my 12-year-old son justifying why he couldn't go outside and play without either putting sunscreen on or just waiting until the UV index went a little bit lower. So I was really proud of that. Anyway, I'm no expert by any means, but I do feel passionate about sun safety and making sure that I'm taking care of my kids' skin. And I know I could do a better job. But anyway, thank you for having me.
Thank you so much, Andrea. What a powerful story. I think what you spoke about encompasses a lot of what individuals go through daily, especially children too, I mean, even what you shared about your insurance, where it's just like a couple days. You're like, just a couple days. But thank you so much for sharing, your family story. And it's incredible to see that your son is a sun ambassador, I like to think. Sun safety ambassador.
Yeah.
That's wonderful. Thanks for sharing, Andrea. So now we're gonna move over. I know we have about 10 minutes left to check in and do some Q&A. We had a handful submitted prior to the start of our presentation. So I'm going to invite Andrea and Maria to jump back on the camera if they'd like. And I'm going to go ahead and spotlight you both. And the first question that was submitted is, if a parent has had melanoma, how much higher is their child's risk of developing it?
Thank you, Caroline. So whenever we have melanoma in a first-degree relative, especially if that diagnosed is earlier in life, before, like in the 30s, 40s, there is an increased risk of melanoma in a child. That risk is about, it goes between like 4 to 7 folds increased risk. That is usually for just a conventional melanoma in the first degree relative. This is different in the case of familial melanoma. That is what we discussed before. When you have that, like the specific gene in the CDK2/8, that it gives a much higher risk of melanoma. And the penetrance of this gene can be quite variable, but the risk factors overall, it can increase to like a 28 increase fold, which then translate to a much higher percentage depending on how, depending on the penetrance of the gene. So I think that overall, the risk increase with the more family members have been diagnosed with melanoma. And once you have a few family members, like 3 or more, like that's really when you start thinking about, is there a genetic predisposition that we should look into?
Thank you for that. That makes a lot of sense. Going off of that, another question we had was how often should a teenager or child with a family history of melanoma have skin checks?
So with family history, again, not a specific, not the familial melanoma, is at least every year. So strong sun safety. I would encourage, like, would really like stress sun protection, sun safety. And then we should all check, like every month, we should do like a self examination, which can be, like after you get off the shower and you put your lotion on in the bathroom, you really want to like look and feel for the presence of uh, those like atypical new bumps. Um, but otherwise, it would be like a every year doing a full body skin check with a board certified dermatologist. Uh, that would be uh, that would be the guidance. Now, things change if we have inherited the familial melanoma gene, and in that case, it's about like 6 months, like every 6 months, uh, there is a need of a full body skin check. Again, that should not preclude your monthly self check. That is important to do.
Thank you for that. And I wanted to just ask Andrea a question here. How did you have kind of sun safety conversations with your son as well after your daughter's diagnosis?
Well, he was only 4 when it happened. And I honestly don't think either one of my kids had ever had a sunburn before that happened. I was already a good sunscreen user, just not quite as crazy as I am about it now. But I was a good sunscreen user before. And now it's like my kids don't know any different. And he certainly complains about it. I just went to his parent teacher conferences earlier today, and his PE teacher was like, he keeps telling me he forgets his sunscreen. I'm like, no, he doesn't. It's in his backpack. I check it every day. It's in there. He's just telling you he forgot because he doesn't want to put it on. So he can definitely be a bit of a stinker too about it. But that's why I was so proud the other night when he was like teaching his friend about why he still needs sunscreen. I thought he's listening, even though he pretends to be defiant about the sunscreen. It is important to him. So
I love it. Yeah, I feel like they always have to push back a little bit. Kids have to try to be kids every now and then.
12-year-old boys, I'm telling you, nothing prepared me for parenting one of those.
That's too funny. I love it. And then just one last quick question here. Somebody submitted, are the long-term effects of pediatric melanoma the same as those seen in adults? And we'll wrap up with that.
Yeah, so overall they are similar. However, as we discussed before, we really think about like the three big categories of pediatric melanomas. The one that we see mostly in adolescents that have really molecular profiling and behavior similar to the adult type melanoma, they have similar risk profile and like long-term implication. The Spitz melanoma is usually usually a higher survival rate. Um, it may have a higher rate of lymphnodal involvement, but overall, the prognosis is generally better.
Thank you. I know we're coming up on time here, so I want to respect everybody's time. And once again, I just want to sincerely thank Dr. Booth and Andrea for sharing their insights and experience with us tonight. We're so grateful for your time and the care that you brought to this discussion. And again, just as some wrapping up points, I also wanted to thank each of you for being here and tuning into tonight's Ask the Expert, whether you asked a question or listened quietly or plan to share what you learned with others. Your participation makes a true difference here. So thank you so much. Again, just wanted to remind everybody to keep an eye out for the survey link that's going to pop up at the end of tonight's meeting, as well as keeping an eye out. I will be sending a thank you email in addition to, in a couple of weeks, I will be sending the recording from tonight's program. So keep an eye peeled for that. And we also hope that you will join us for future programs and continue to stay connected with the Melanoma Research Foundation community. And until then, take good care, and I am wishing you all the best. And thanks again for being here tonight. And thank you, Andrea and Dr. Buethe. It's been a wonderful discussion.
Thank you very much, everyone.
Thanks, everyone.
Thank you.